So tell me, what is the problem that Navican is trying to solve?
We have hundreds of thousands of metastatic cancer patients in the United States alone, not to talk even about
even
the
worldwide.
worldwide situation. And while technologies are available to sequence, for instance, as you mentioned earlier, to analyze the variants and mutations associated with disease and potentially with therapy, the reality is, while we have hundreds of thousands of these patients, only in a small fraction, a few percent of all cases, a change in therapy actually is taking place. That's the true problem. It's not whether we can sequence or whether we can identify mutation, not whether there's a drug that would be the right therapy for a specific patient. Those problems have been solved to a degree and are currently worked on every day by many amazing organizations. The problem that I see, and that's out there in the community, is that most of these patients never get a chance to go from standard of care, chemotherapy, into something that's much more productive for them, given what we know about them, aka their genomic makeup, their variant and status on the tumor site. Would you agree with that statement, or do you see that different?
There's no doubt that a major challenge in this country and worldwide is that we have, in this country alone, 500,000 patients with advanced cancer.
Yeah.
And the question is how to treat those patients. There are maybe one or sometimes two standard treatment regimens for patients with advanced cancers of various types. And after that, the question of how to help these patients becomes really unclear really quickly. Precision medicine is one of the approaches that people are recognizing can help these patients. And the challenge is, how do we deliver that? How do docs in community settings know how to offer patients these opportunities? That's what Navican is solving.
Yeah.
It's taking these patients with advanced cancer and offering them access to cutting-edge technology, interpretation by a sophisticated molecular tumor board, and even procuring drug.
Yeah.
We believe at Navican that every patient is entitled to a fully informed treatment decision.
Yeah.
And those treatment decisions, that full information comes with this end-to-end precision medicine service.
Yeah. So we recently named the child Theramap.
Yeah.
Are you proud you're the father?
Theramap
And
is beautiful, yes.
Yeah.
Bouncing baby service.
Very good. So baby's name is Theramap. One thing I would like to have you validating whether I'm too aggressive about it. My belief is that the vast majority of metastatic cancer patients, or cancer patients in general, are community-based. I have read different statistics. I would say 80 or more % of oncology patients are community-based and not part of an academic medical center. Would you agree, or am I going too aggressive towards that direction?
Well, the homepage of the National Cancer Institute, which is one of the NIH-sponsored institutes and really leads and establishes policy for cancer care in the United States, along with ASCO and NCCN, their homepage states that 85% of cancer patients in the United States receive their care in community cancer centers, and the other 15% or so receive their care at academic medical centers. So the vast majority by far of cancer patients in the United States are treated in community centers.
There you go. Precision medicine for all and not just a few.
That's right.